I'm Matsuzaki, a psychiatrist. Today's topic is the manipulative behavior seen in people with borderline personality disorder, or BPD. People with BPD are often said to try to manipulate others frequently in interpersonal situations. Manipulative behavior, commonly seen in people with BPD, not through persuading others with logic or making a normal request, but through other methods,
refers to actions that attempt to make others behave in the way they want. In interactions with others, they may sometimes try to assert their demands directly, or they may avoid saying things outright and instead work behind the scenes to make things go the way they want. Manipulative behavior in people with BPD can include persistently pleading, threatening, inducing a sense of guilt, emotionally shaking the other person, appealing strongly to emotion, telling intentional lies, or creating situations where the other person has no choice but to comply. Various methods like these may be used. These behaviors are sometimes thought to be carried out unconsciously on the part of people with BPD. But in reality, they are often done with a clear sense of purpose. This purpose may be to obtain something, or it may be to avoid something negative. And it is often said that people with BPD have strong Machiavellian tendencies. That is, that they will stop at nothing to achieve their goals. However, this does not appear to be true. People with BPD and those without BPD are said to be about equally likely to choose or not choose the means they use to achieve their goals. However, people with BPD tend to feel anger or sadness more easily in response to negative events, because things often don't go well for them. They face many situations in which they must avoid negative outcomes, and this may be why they appear to engage in manipulative behavior more often. Such interpersonal manipulation can quite easily end up leading to various problems with those around them and has the potential to damage relationships. So this requires caution. And through these experiences, their mood may also tend to become depressed. This too requires attention. And although this video focuses on the manipulative behavior seen in people with BPD, there is something important we need to be careful about. That is, when healthcare professionals or people around them interpret a person with BPD's words or actions as manipulative, they may become preoccupied with not being manipulated. Their empathy may decrease, and in some cases, they may become critical or rejecting toward those words or behaviors. The manipulative behaviors seen in BPD are often part of a struggle to escape from emotional pain. It is desirable for those around them to respond with empathy to the emotional pain experienced by people with BPD. So that was today's discussion on the manipulative behavior seen in people with BPD. But to be honest, many things are quite difficult in real situations. But well, I reminded myself that these are things I need to be mindful of too. If you felt you learned something from this video, please feel free to go ahead and share it with others on social media if you'd like. Maybe? That's all.